Your health is your wealth, but how many of you actually prioritize health checks? It could be in your 20s, 30s, 40s, 50s and beyond. But let's be honest, how many of you, or including myself, how many of us do it? Really, be honest. Life can be busy and we sometimes miss these appointments, but it is important that we schedule appropriate time for the health check so prevention can be implemented and long-term benefits can be reaped. Today, we will talk about the important health checks that you need to schedule in your 20s, 30s, 40s or beyond. This could be routine screening tests to life-saving tests. So sit back and relax so we can go through these steps one at a time so you can take control of your health. Before we proceed further, you should be able to share this video to your loved ones or other important women in your life. So subscribe so you can get the notifications as soon as videos are in. So why are health checks non-negotiable? Prevention is better than cure, and it's better to be safe than sorry. Early detection of any condition can save lives or improve your quality of life with appropriate implementation of management. And we as women are a unique species because of the hormonal changes that our body goes through in various phases of life. So the health checks are tailored uniquely for women. Did you know that 80% of serious health conditions are preventable in women? So let's start with what are the health checks that are needed for a woman in 20s. 4 important health checks that are required are your general physical health check, your reproductive health check, then breast health and mental health. So what does a simple general physical health check involve? So that basically involves making sure your weight is appropriate for the height. So we calculate your BMI, make sure that's in the appropriate range. We also do your waist circumference, which is a predictor of heart disease, and discuss those implications with you. As a part of that examination, your pulse rate and blood pressure is also evaluated. Reproductive health and breast health probably can be combined. It varies from country to country, state to state, depending on what your local guidelines state, but also when a woman becomes sexually active. Some of the reproductive health checks include something like cervical screening test or pap smear test, if that's how it's called in your country. In Australia, the screening for cervical screening starts at the age of 25. An important aspect of this screening at this time frame is sexually transmitted infection screening if you are sexually active. For the breast health, it could be as simple as you performing a breast self-examination or becoming what we call as breast aware. So women in 20s, you guys are generally completing school, entering uni or busy with uni. So there's already enough pressure there. But looking after your health is, of course, very important. So due to the pressure, you can struggle with anxiety or depression. So it's important that you become aware of those symptoms and seek help if needed. The other important thing that you guys need to be aware of in your 20 years is that this is the important time when your bones are being built. So really important that you exercise, lift some weights so the bone health becomes appropriate. So your 20s are your building block for your future. So don't let undetected health issues ruin that for you. So the next decade is the decade of 30s. Most women by their 30s have finished their education, settling down in their careers, but want to start a family. So what's the focus in this age group? Obviously, if you're planning to start a family, reproductive health, then general health, then heart health, bone health, as we've discussed before, and that's it. So going back to reproductive health, obviously that involves both looking after your breast as well as if you're planning for pregnancy, then you can have pre-pregnancy discussion with your doctor. That would also include your general health check and the sexually transmitted infection screening. It may also include screening like the cervical screening test or the pap smear, and your general health check would include bloods for your iron levels, your vitamin D, your vitamin B12, folate and calcium, magnesium, zinc, blood sugar, a very important one, especially if you have a family history of heart disease. Then your blood sugar, cholesterol becomes very important in the testing. Do you think that heart disease is a problem of the old? No. The damage starts as young as 20 or 30. So it's important to get detected, take preventive action now. We'll move on to the next decade, which is the 40s. Actually, we can combine and say 40s and beyond. So it's very similar to the 20s and the 30s, but the added extra test would be the mammograms. Also, colorectal screening starts at this age group, especially if you have a very strong family history of colorectal cancer. Let's go deeper into the screening protocols just for a few conditions here. So I want to mention something about, first thing is mammogram. So the mammogram, the regular screening starts from the age of 50. It's every 2 years, but there is one free mammogram that is offered between 45 to 50 years of age. And this can be organized in Australia through Breastscreen Australia. The next thing I want to talk about is cervical screening or pap smear. So traditionally, cervical screening or pap smear was performed every 2 years. But since the introduction of a new technology where HPV virus can be detected, the screening age has been pushed from 18 to 25 years of age. And if the cervical screening test remains normal, it has to be performed every 5 years. Screening for colorectal cancer starts at the age of 50 in general, but earlier if there is a strong family history. So speak to your healthcare professional about that. Screening for skin cancers, there's actually no age limit. It can start from very young and it can be continued up well into your 60s, 70s, 80s, any age group basically. How do we screen for heart health? We did mention that that's important right from a very young age, that is at 20s. So first thing would be just having your blood pressure checked at any opportunity that you have with your healthcare professional. Obviously, as women get older, so from 45 years of age, not only blood pressure should be checked, but a cardiovascular risk assessment is to be performed, which would include your age, your blood pressure, your cholesterol, your smoking status, your family history, and your ethnic origin and where you live. Brief mention about STI screening or sexually transmitted infection screening. That should be performed right from the time a person becomes sexually active. A quick mention about immunizations. If you are up to date with all your childhood immunizations, sometimes boosters may be required in your adult life. We had mentioned about metabolic screening like bone health. So when do we start the screening for that? Screening for bone health generally starts at the age of 50 unless there's a strong family history of osteoporosis. That would include clinical examination and bone mineral density scans. The bone mineral density scans are performed once every 2 years, or if there is a history of fall or broken bone. So 40s and beyond, high risk category for metabolic diseases. So how and when do we screen for these? Metabolic diseases are diabetes, high blood pressure, and cardiovascular health. So generally the screening starts, as mentioned earlier, in the younger age group, 20s or 30s, but appropriate bloods are organized at the age of 40 and beyond, including your fasting blood glucose. But if your BMI is high or if you feel you're overweight, your healthcare professional may request these bloods a bit earlier. Life can be very stressful at any stage in a woman's life, but it does get more stressful after 40. So it's important to get screened for mental health. So what are some of the questions that you may be asked for mental health screening? So there will be questions regarding alcohol intake, smoking or vaping. This would be at every opportunity that you get to meet with the healthcare professional, and also screening for anxiety, depression and stress opportunistically, or if you indicate that that is something that you're struggling with. So the health challenges that you face at 40s and beyond can be quite unique and different. The right tests can help break them down and better manage it for you. Some of the common myths around these health checks, and I'm sure we all have heard about it. I'm well, I don't need any health check. That is the first and most common myth. Health checks are only for older women or not required for women. That's the other common myth. If you're in your 20s, you don't need a health check? No, definitely you do need one. So prioritize that. Here are a few tips to help health check a priority. Luckily, we all have smartphones. So put a reminder in your calendar. Again, most smartphones will have the parameters that can be recorded. Your height, weight, blood pressure, your stress and anxiety levels, all of them are being tracked. So make sure you create a journal either in a soft version or a hard copy, so you can monitor any of the symptoms or signs that you're worried about. We have always been taught, choose your group of friends. It's probably time to rethink what your group of friends should be thinking. It should be about health. Do you want to stick to your health goals? One simple trick is to be with like-minded women. What can you do to optimize your consultation with your healthcare professional? Journal your symptoms and share it with your healthcare professional without hiding anything. So be honest. You can definitely discuss about screening, the tests available, and what options in terms of treatment and management are available. Most importantly, don't forget to organize follow-up and follow on with the advice that your healthcare professional has provided for you. Your healthcare professional is your partner in health. So make sure you make every consultation count. So your health deserves your attention at every stage in life, be it 20s, 30s, 40s, or 50s and beyond. No need to wait. Schedule a healthcare check today so you can get on and move ahead in life. If you would like, there is a link below that you can click on to book your healthcare or health check appointment. Share it with your friends or the important women in your life if you do like this video.